In this lecture, we'll try to study the pathophysiology and pharmacology and also treatment guidelines for bronchial asthma. So before understanding about bronchial asthma, let us try to see some basic things. Okay. In basic things, what we have, first of all, to understand the asthma condition, we should know about lungs. We all know that we have trachea, right? We have trachea, and trachea is mainly dividing into two branches, which is called primary bronchiole, which is called primary bronchiole or primary trachea बोल सकते हैं. Okay, we have right primary bronchiole and left primary bronchiole. So the right primary bronchiole is entering into the right lung and the left primary bronchiole is entering into left lung, right? See, we have two lungs. We have two lungs. The right lung has two fissures. You know fissures? You know how many of you know about fissures? Right lung has two fissures, and these two fissures divides the right lung into three parts. The upper part of the lungs is called superior lobe or upper lobe. The middle part is called the middle lobe, and the last ending part, final part is inferior lobe or lower lobe. Inferior lobe or lower lobe. Okay, and this right lung, सब लोग ध्यान से सुनो, this right lung is approximately in adults approximately its weight is between 375 grams to 550 grams. Right lung is having two fissures, and it is these two fissures are dividing into three lobes: upper lobe, middle lobe, and lower lobe. And this right lung is bigger than left lung. Right lung is bigger than left lung, and right lung is approximately 375 to 550 grams in adults. Actually, this is in adults, and the average weight of this lung is 450 grams. Average देखे तो it will be 450 grams. So the right lung weight is around 450 grams. आसपास आधा किलो. Okay, it is approximately 450 grams in adults. And the left lung is having one fissure, and this one fissure divides the left lung into upper lobe and lower lobe. Upper lobe and lower lobe. Left lung has two lobes, and the weight of left lung is approximately between 325 grams to 450 grams. 325 grams to 450 grams, and its average weight is 400 grams. तो अब देखो, right lung was 450 grams and left lung is 400 grams. This means the right lung is bigger than left lung. Can anyone tell me why right lung is bigger than left lung? Anybody from the class? Because of heart. Exactly. See, we have in the left part we have heart here. So due to the presence of heart, the size of left lung is lesser than the right lung. And one more very very important point. सब लोग ध्यान से सुनो. We have right main bronchi, right? This is right main bronchi. Right main bronchi is more vertical than left main bronchi. We have two main bronchioles. This right main bronchiole is more vertical. उसका meaning क्या है? The right main bronchiole is more vertical. What is its meaning? What is it? Exactly. See. This is trachea, and when right primary bronchiole or right main bronchiole enters into the lungs, its direction is like this. Whereas the left main bronchi is like this. इसका meaning क्या है पता है? Whenever person inhales or whenever person sometimes the dust particle or sometimes the aspiration food particles what we take from the buccal cavity, sometimes what happens when you keep talking while eating, sometimes what happens, the buccal substances, food items will directly enter into the trachea, and that type of conditions will cause aspiration pneumonia. And in that situations, the aspirated particles which travels from the trachea, what it does, it will mainly enter into right side of the lung. याद रख लो, whenever patient aspirates something, the aspirated particle will try to enter into right lung. The probability of entering the substances is more in the right lung than in the left lung. Why? Because the right primary bronchiole is more vertical. समझ गए सब लोग ये point? Understood this point? This is the main anatomical part we have to remember. Clear everybody? Now you see. Now we will go some more basic points. Now we will try to see the different parts of the bronchioles. Before that, what exactly asthma is? What is asthma? Can anyone define what is asthma? In simple terms, what do you know about asthma? Asthma क्या है? Increased responsiveness of tracheobronchial tree. Now you see, increased means elevated physiology. Okay, what is increased responsiveness? Increased responsiveness. SIVE. Increased responsiveness of tracheobronchial tree. Now we will try to understand the basic anatomy of tracheobronchial tree. Once if we understand this tracheobronchial tree, then I'll explain you what is responsiveness, increased responsiveness of this tracheobronchial tree. तो सब लोग ध्यान से सुनो यहाँ पे. See, just now I was explaining you the main trachea. Actually the trachea is divided into two main bronchi, right? Trachea is divided into two main bronchi. One enters into the right lung and one enters into the left lung, right? This is main bronchi. Main bronchi is again dividing into some lobar and segmental bronchs. From the main bronchi, there are some other small branches. 2 to 10 branches will be coming out from the main bronchi, and they are called segmental bronchi. From the main bronchi, 2 to 10 branches will be coming out. They are called lobar and segmental bronchi. And the lobar or segmental bronchi again divides into 11 to 16 branches, and they are called terminal bronchi. And terminal bronchi again divides into many branches, 17 to 19 branches. They are called respiratory bronchioles. And respiratory bronchioles again divides into many branches, 20 to 22. They are called alveolar duct. And finally, the alveolar duct will enter into the alveoli sac. These all branches is called branching of bronchial tree or tracheobronchial tree. Tracheobronchial tree समझ गए? मेन ट्रंक रहता है, ट्रंक से there are so many branches arising from the main trunk. Okay, see, one thing everybody should remember: the trachea, main bronchi, and lobular bronchi or lobar or segmental bronchi. These parts, the main branches are having C-type cartilages, and C-type cartilages are slowly decreasing in the terminal bronchi, respiratory bronchi, and alveolar duct. In the image, it is very clear. The main bronchi, the segmental bronchi are having C-type cartilages, and as the branches increases, the branches are not having C-type cartilages, and they are only made up of smooth muscles. इसका मीनिंग बहुत इंपॉर्टेंट है. इट्स सिग्निफिकेंस वी हैव सो मच to understand the asthma and pathophysiology. You have to remember what is the main point here. The main branches are having C-type cartilages, and the remaining terminal respiratory branches or terminal bronchioles, whatever they have, they are not covered with C-type cartilages, despite they are covered with simple smooth muscles. Clear? See, now these C-type cartilages will try to help these tubes or this trachea and the main bronchi to be opened all the time. And the terminal bronchi, respiratory bronchi, and the alveolar ducts will not be opened all the time because they are made up of smooth muscles. Smooth muscles contract होगा तो क्या होगा? Bronchus will be constricted. If it is relaxed, bronchi will be dilated. But here, if smooth muscles are contracted, here the bronchi or this main bronchi will not be constricted. Trachea will not be constricted. Why? Because it is made up of C-type cartilages. The concentration of smooth muscles are less in the main bronchi, and the concentration of smooth muscles is more in the terminal bronchi. This one you have to remember. I think this point is clear. Tracheobronchial tree सब लोग समझ गए, right? सब लोग समझ गए? Now, yes, now you see, I want to give you one more basic thing. With this basic thing, you will understand total concept. See, ध्यान से सुनो सब लोग. If we see, just imagine this is the terminal bronchi. This is the terminal bronchi, right? When we cut the terminal bronchi in the transverse section, we can see the terminal bronchi like this. Am I right? अगर terminal bronchi को अपन ऐसा कट करके TS में देखें तो it will be visible like this. And this terminal bronchi is having 3 layers. The innermost layer is simply made up of epithelial cells or mucus cells. दिस इज द इनरमोस्ट लेयर. सब लोग ध्यान से सुनो, ये बहुत इंपॉर्टेंट है पैथोफिजियोलॉजी समझने के लिए. दिस इज वेरी इंपॉर्टेंट. This is the innermost layer which is made up of epithelial cells, right? Epithelial cells or mucus cells. And the next layer on the top of on the what we say, on the epithelial cells we have one layer which is called lamina propria. Lamina propria. Have you heard about this? This is the second layer. Second layer is lamina propria. This layer is made up of basement membrane, and it is a what we say, it is a fatty type of tissue, fibrous tissue. It is a fibrous tissue. Simply we can say it is made up of connective tissue. It is connective tissue. Okay, it is connective tissue. And one more layer on the lamina propria we have smooth muscles. On the lamina propria we have this is smooth muscle. The third layer is made up of smooth muscles. Clear, everybody? Actually, I am explaining you the terminal bronchi TS. I am not explaining about the primary trachea and all, primary bronchi, trachea, bronchi. See, in trachea and in primary bronchi, what will happen? Externally, it will be having cartilaginous tissue. Okay, C-type cartilaginous tissue will be there. It will be covered with cartilaginous tissue. This C-type cartilaginous tissue, what it does? It will make the tube patent all the time. Patent means open. This C-type cartilage will always make the tubule to open all the time. And this C-type cartilage is present in trachea and in primary bronchioles, right? As primary bronchioles divides into many branches, this terminal bronchi is not having C-type cartilages. Despite what it is having only 3 layers. I think this point you all understood. Yes, you all understood this point, everybody? अब देखो, in the definition what we discussed, increased responsiveness of tracheobrachial tree is called asthma. I just told you. Now you see, to understand the pathophysiology, this is the simple TS of our tubule. These epithelial tissues, what it does, these epithelial tissues will try to synthesize some mucus. Whenever mucus is produced, here we have some thread-like cells, or we have some laminar cells, and we have cilia type cells. What all these cells does, whenever excess mucus is produced here, it will be expelled out through cough. Whenever excess mucus is produced, it will be expelled out through cough. And in some cases, what happens, more production of mucus, what it does, it will obstruct the bronchioles, and that will lead to shortness of breath. Now we will discuss why epithelial cells will produce excess mucus, in which situations it will produce excess mucus, and why these bronchioles will show excess responsiveness. क्यों दिखाएगा, that I will try to explain you now. See, before that, one more point you should remember. See, exact definition of asthma is nothing but it is the chronic inflammatory disease. It is chronic. It is always chronic. Asthma is not एक आज आया कल चले गया and it came only once in the life. ऐसा नहीं है. If asthma develops or if asthma attacks to the patient, it will stay lifelong. So, or it not lifelong, it may be controlled, but frequently asthma symptoms will be coming to the patient. That's why asthma is a chronic inflammatory disorder. It is a chronic inflammatory disease. Chronic means it will stay in the body for a long period of time. Okay, अगर एक बार आया तो उसके बाद permanently नहीं जाएगा. It will stay in the body. That is chronic and inflammatory. Inflammatory means inflammation. Just now some of you told inflammation of bronchioles. I'll explain why bronchioles will be inflamed. In pathophysiology you'll understand. It is the chronic inflammatory disease of airways. Airways means bronchioles. Simple. Airways means bronchioles, which occurs in susceptible individuals only. Asthma is seen only in susceptible individuals, not in everybody. जो भी patient is having risk of asthma, they are called susceptible individuals. It will occur only in susceptible individuals. So asthma is a chronic inflammatory disorder of airways which occurs in susceptible individuals. And the inflammatory symptoms, what it does, it will cause obstruction in the airway, and what that obstruction usually occurs due to the variety of stimuli. So many stimuli will cause obstruction, they'll cause inflammation, and through that it will develop chronic inflammatory disease. And this obstruction may be relieved simultaneously, spontaneously, simply without any treatment. Without any treatment also sometimes it will be decreased, and sometimes treatment is required. In few cases, acute, in what actually in asthma we have mild, moderate, and severe cases. In mild cases, what happens, asthma attack comes to the patient, and after some time that asthma symptom will be relieved spontaneously without any treatment. So sometimes if symptoms are aggravating, it requires treatment. So treatment and spontaneously treatment भी कम कर सकता है, without treatment also sometimes asthma symptoms will be decreased. This point you have to remember. But in severe asthma, definitely treatment is required. Clear? I think definition you all understood. Now you see, this is the simple diagram. It is the hypothetical diagram. See, this is the bronchiole. This is normal bronchiole. The lumen size of the bronchiole is very large. The width of this lumen size is very large. And this is the inflamed bronchiole. Inflamed bronchiole में क्या है देखो, all this epithelial tissue got inflamed, and it is showing the obstruction. Here lumen size got decreased. So by this decreased lumen size, what it does, it will cause obstruction, and it will decrease the airway flow from the trachea into the alveoli, and from the alveoli to the trachea, and through that it causes shortness of breath. Iske mechanism I'll explain you in detail now. See, I think you all understood the definition. Now you see, everybody should concentrate here. The actual concept will start here now. See, number one, सब लोग ध्यान से सुनो. We have some triggering agents. We have some triggering agents. These triggering agents, what they do, you know, these triggering agents, they will try to stimulate the Th2 cells. How many of you heard about Th2 cells? Th2 cells. This is very, very important. Actually, these Th2 cells are the type of immune cells. These Th2 cells are the particular immune cells. These Th2 cells are very, very important. You know, these Th2 cells are associated with three conditions. You have to remember, everybody, these Th2 cells are associated with three disease conditions. I mean, these Th2 cells will cause three disease conditions. Number one, they will cause asthma. Okay, they'll cause asthma. They'll cause atopic dermatitis. They'll cause atopic dermatitis. Have you heard about dermatitis? Atopic dermatitis. And they'll also cause allergic rhinitis. Allergic rhinitis. Rhinitis, I think in first year I explained you. See, these Th2 cells will cause three disease conditions. Number one, it causes asthma, it causes atopic dermatitis, and it also causes allergic rhinitis. These three conditions are mainly associated with Th2 cells. Clear? And these Th2 cells which causes these three disease conditions, is called atopic triad. These three disease conditions is called atopic triad. So atopic triad is caused by which type of cells? Atopic triad. Yes. Atopic triad is the term which explains about Th2 cells. This Th2 cells, what it does? It will cause asthma, atopic dermatitis, and allergic rhinitis. See, atopic triad karke, you have to remember this point. Now, in previous classes also I explained triad ke bare mein bol rahe, to I remembered some other terms. See, there is one more term called virtuous triad. Have you heard about virtuous triad? Virtuous triad. Virtue is this name of the scientist. Virtuous triad करके बोलते. Virtuous triad. This concept is totally not related to asthma, but just for understanding purpose I am explaining. Atopic triad means Th2 cells. It causes asthma, atopic dermatitis, and allergic rhinitis. We know. How many of you heard about virtuous triad? Anybody from the class? Virtuous triad करके सुने नाम? Okay. Yes, Romil, what is virtuous triad? Where did you? Yes. Exactly. Very good. Excellent. See, there is one condition called venous thromboembolism or venous thromboemboli, or simply it is called thrombosis. Thrombosis करके एक disease condition है. When a patient crosses 50-60 years of age, they are having high risk of developing thrombus or clot formation. What this thrombus does? This thrombus will try to it will travel from one place to another place by causing emboli. And what it does, it will cause obstruction in the blood flow to some major tissues. for example, in the brain, in the heart, and many other tissues, and it causes myocardial infarction in the heart and stroke in the brain. These all points we will discuss one day. See, virtuous trade is the condition which explains about VTE. If anybody has stasis, or if anybody has hypercoagulability, or if anybody has endothelial injury. Endothelial injury means the endothelial cells of the blood vessels. अगर endothelial cells of the blood vessels rupture हो गए, and if anybody has hypercoagulability, or if anybody has stasis means if anybody is maintaining in the sleeping position, if they are not doing physical activities, तो क्या होगा? Blood will not move from one place to another place. That is called stasis. अगर किसी भी पेशेंट में stasis है, hypercoagulability है और endothelial damage है, तो that three conditions, what they'll do, they will aggravate VTE, or they will cause venous thromboemboli. So these three conditions which causes VTE is called virtuous trade. Okay, understood everybody? Virtuous trade. And see, one more trade is there. I just remember one more trade. There is another trade called Cushing's trade. Cushing's trade. Have you heard about Cushing's trade? Cushing's trade करके condition है. Have you heard about Cushing's disease? You have to tell me what is Cushing's disease. Yes, Sadab should tell what is Cushing's disease. What is Cushing's disease? Okay, I'll not waste time. See, Cushing's disease is nothing but the increased levels of corticosteroids in the okay. That point already I explained in previous classes. See, that is called Cushing's disease. There is another condition called Cushing's trade. Cushing's trade is the condition where patient will have elevated systolic blood pressure. सब लोग ध्यान से सुनो यहाँ पे. Cushing's trade बोले तो patient will have elevated systolic blood pressure, and patient will have decreased pulse rate, and patient will have decreased respiratory rate. Respiratory rate कम हो जाएगा, pulse rate कम हो जाएगा, but systolic blood pressure बहुत ज़्यादा हो जाएगा. These three conditions are especially seen in Cushing's disease, and in Cushing's disease, these three conditions, increased systolic blood pressure, decreased pulse rate, and decreased respiratory rate, this condition is called Cushing's trade. याद रख लो, Cushing's trade क्या है? अगर किसी भी पेशेंट में if anybody has Cushing's trade, that is very very dangerous condition. In Cushing's trade what happens? Blood pressure will be very very high. Actually blood pressure ज़्यादा है तो क्या होगा? Pulse rate and respiratory rate decrease हो जाएगा. अब देखो there is one condition. Actually see, we have stroke, right? In stroke we have hypovolemic stroke, we have cardiogenic stroke, we have neurogenic stroke, and we have anaphylactic shock or stroke and shock are almost same. Okay, and we have septic shock. Actually these are shocks. These are shock condition बोलते हैं, shock or stroke, shock. We have hypovolemic shock, we have cardiogenic shock, we have neurogenic shock, we have anaphylactic shock, and we also have septic shock. In all these shock conditions, what you will find, you will see exactly opposite to Cushing's trade. याद रख लो, ये all these things in any textbook you will not find. पूरे condition के I'm explaining the interpretation. Okay, I'm interlinking all points. In Cushing's trade, what we have seen elevated systolic blood pressure, we have seen decreased pulse rate and decreased respiratory rate. But in shock, in stroke and in shock, what we will find? In all the kinds of shocks, blood pressure will be rapidly decreased, hypotension रहेगा, and pulse rate will be increased and respiratory rate will be increased. This is exactly opposite to Cushing's trade. Understood everybody? समझ गए सब लोग Cushing's trade क्या है, शॉक में उसका रिलेशन क्या है, what is virtuous trade, and what is one more trade what we have seen atopic trade. Clear everybody? All these basic things? Yes. Actually these points are totally different from asthma. Now you see, we will go back to the asthma now. I think you all are following me. थोड़ा बहुत इधर उधर भी भागते रहते हैं अपन, बट डोंट वरी, ये सब बेसिक थिंग्स वी विल फाइंड. सी, नाउ विल कम बैक टू द asthma. In asthma, what I told, if patient has triggering factor, if any patient has triggering factor, what it does, triggering factors. In triggering factors we have so many factors that I'll explain you. The list we have. दिस ट्रिगरिंग फैक्टर्स पर्टिकुलरली सबसे वेरी 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 इंपॉर्टेंट ट्रिगरिंग फैक्टर, याद रख लो सब लोग, वेरी वेरी इंपॉर्टेंट ट्रिगरिंग फैक्टर. व्हाट इज दिस? व्हाट इज दिस ट्रिगरिंग फैक्टर? Very very important triggering factor. Exactly, cigarette smoke. This cigarette smoke, what it does, this is very very important triggering factor. अस्थमा में सबसे ज़्यादा important है. This smoke, what it is one of the triggering factor. When this triggering factor exposes to the patient, कौन से patient? Susceptible patient. Okay. Susceptible patient means who is having hypersensitivity or who is having more susceptible to get asthma or who is already having asthma. So this triggering factor, what it does, it will stimulate TH2 cell. First क्या होगा? Triggering factor will be, it will stimulate TH2 cell. Clear here everybody? This TH2 cell, यहाँ से अब कहानी शुरू होगी. देखो, this TH2 cell, this when this cell is stimulated, it will produce two types of interleukins. It produces interleukin 4, सब लोग ध्यान से सुनो, and interleukin 5. Interleukin 4 and interleukin 5. This is very very important. When TH2 cells is stimulated by triggering factors, it produces two types of interleukins particularly. One is interleukin 4 and one is interleukin 5. Clear? This interleukin 4, यहाँ से देखो, these two are very important. This interleukin 4, what it does, it will go and it will activate immunoglobulin E, IgE बोलते, IgE. Okay. This interleukin 4, it will stimulate or it will produce IgE, and this IgE will go and attach on the mast cells. You know what is mast cell? In previous class I explained. Mast cell, it will go and activate mast cell. Mast cell is filled with histamines. Mast cells were filled with cytokines, and mast cells are also filled with platelet activating factors. When this mast cell is stimulated, it will सब लोग ध्यान से सुनो, it will produce proteases, very very important, the enzymes which will degenerate the proteins which are important for elasticity of bronchioles. See, this is bronchiole smooth muscle and bronchiole tubule. These bronchioles are elastic in nature. When more proteases are produced, what it does, it will try to degrade the proteins which are present in the bronchioles, and through that what it does, it will decrease the elasticity of bronchioles. It will decrease the elasticity of bronchioles. Very 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 important point. So when mast cell is activated, what it does, it will produce proteases, it will produce histamines, very very important. It will produce it will produce heparin, very important. Heparin also it produces, and it produces platelet activating factor. Yes sir, these are very very important. And इसके साथ thromboxanes also, it produces thromboxanes. See, let me repeat, when TH2 cells are activated, it produces interleukin 4 and interleukin 5. I am explaining about interleukin 4. Interleukin 4, what it does, it will produce IgE. IgE activates mast cell, and mast cell produces all proteases, histamines, heparin, platelet activating factor, thromboxanes, and sometimes leukotrienes also again. Okay, so now you see what all these things will do. I'll explain you. These are all inflammatory mediators. ये सब क्या है? Krina. These proteases, histamines, heparin, platelet activating factor, and thromboxanes, these all are inflammatory mediators. Are you following, Krina? Yes, yes. See, so when mast cell is activated, it will produce all these inflammatory mediators. Now you see, now we'll go back to the interleukin 5. This interleukin 5, what it does, interleukin 5 will go and stimulate or it will activate eosinophils. You might have heard about eosinophils. Eosinophils will be activated, and these eosinophils, what they do, eosinophils will produce some more cytokines, and in that particularly leukotrienes. Okay, some more cytokines will be produced by eosinophils, and these cytokines, leukotrienes, these proteases, histamines, heparin, all what they do, they will show three actions. सब लोग ध्यान से सुनो, all these inflammatory mediators will show three actions. What three actions it will show, I'll try to write here. All these inflammatory mediators from the mast cells and from the eosinophils, they will show three actions. Number one, these inflammatory mediators will cause narrowing of airway passage. First, what they do, they'll cause narrowing of the airway passage. Number two, they will cause increased production of mucus. They will increase the production of mucus. And number three, it will cause vascular permeability. What is vascular permeability? Anybody from the class, what is vascular permeability? What is vascular permeability? Exactly. See, this simple, we have blood capillary, no? Blood capillary, manlo, this is one blood capillary which is made up of simple endothelial cells or epithelial cells. When these capillaries are dilated rapidly, these blood vessels are dilated due to the histamines, due to the platelet activating factor, and due to the thromboxins. And what happens? This fluid, which is these capillaries, which is containing the eosinophils, all macrophages, and some other blood substances, what will happen? They will leak again into the lungs में फिर लीक हो जाते हैं. And through that, what happens? More eosinophils will be accumulated in the body, and more production of leukotrienes again, and it will again produce more cytokines, TNF alpha, leukotrienes, histamines, platelet activating factor, that will be increased. And through that, what happens? Again, narrowing of the lumen, increased production of mucus, and again it causes constriction of these all three. What they do, they'll cause constriction of bronchioles. Simple. All these activities is called hyperactivation of tracheobronchial tree. अब देखो, narrowing of the bronchiole and excess production of mucus. What this is simply, its meaning is hyperactivation. Bronchial activation बढ़ जाएगा तो क्या होगा? More production of mucus can be seen, and through that it will cause bronchoconstriction. This is called hyperactivity of bronchioles or hyperactivity of bronchotracheal tree. Clear, everybody? This is the simple pathophysiology of asthma. Actually, asthma समझने के लिए we have so many other hypotheses, but you can remember this one. Clear? You understood this pathophysiology, everybody? समझ गए सब लोग? Now you see, we have some factors. अब देखो, pathophysiology में nothing. If we have some factors, triggering factors, what they'll do at the end, the bronchiole will be constricted, and the inflammation of the bronchioles can be seen, and more production of mucus can be seen, and the elasticity of this bronchiole is decreased, and the width, the lumen size will be decreased, and through that, what it does, it will cause obstruction, and through that it will cause shortness of breath. Simple. That is called asthma. Obstruction of bronchioles due to inflammation is called asthma. सिंपल. ऐसा भी आप याद कर सकते. अब देखो, we have some very important factors. In factors that causes asthma, we have genetic factors, number one, and we have environmental factors. See, nowadays in new researches, what they are telling, some kinds of asthma are also associated with genes. Agar if parents are having asthma, due to their genes, their children also will get asthma, because they are having same genes. And some people without genetic cause, some people will develop asthma due to environmental causes. Now you see, we will focus on environmental causes. In environmental causes, there is one very important concept called hygiene hypothesis. How many of you heard about hygiene hypothesis? hygiene hypothesis. कोई सुने नाम? How many of you heard about hygiene hypothesis? Anybody from the class? Yes? नहीं, सुनो, अब लोग सुनो. Actually, this is the hypothesis. इसका exact अभी तक some controversies are there. Hygiene hypothesis का meaning क्या है बोले तो सुनो सब लोग, ध्यान से सुनो. See, in early stages, when we are children, when we are small in the school, in the early stage, if a patient or if a student or if anybody is exposed, if they are exposed to some virus, if they are exposed to virus, bacteria or fungi or allergens, more allergens, if they are exposing to many kinds of bacteria, virus, fungi, allergens, if they are exposing to all these things, what happens? Their immune system, what happens? Their immune system will be elevated. Their immune system will be elevated. This concept is called hygiene hypothesis. Hygiene hypothesis क्या है? In the early stages, if the patient is exposing to various kinds of external virus, bacteria, allergens and all, they will provide or they will have good immune system करके थोड़े scientists बोल रहे हैं. That hypothesis is called hygiene hypothesis. But some scientists are not agreeing to this. अब देखो, when I was small child, I used to not wash my hands because I was not aware. I don't know. Villages में कैसे रहते? I used to not wash my hand. I used to not bath regularly. क्या बोलते? गांव खेड़े में कैसे रहते? पूरे गलीज गलीज रहते, कपड़े बराबर धोते नहीं. So when you are coming from such background, your immune system will be highly developed. And in upcoming, when you are in young or when you are in mature situations, what happens? If the same person exposes to some environmental conditions, धूप में गए, पानी में, बारिश में भीग गए, or if they expose to certain situations, what happens? They are resistant already because their young age was already exposed to some bacteria, virus and all. Their immune system is very well developed. And this kind of concept is called hygiene hypothesis. You understood, everybody, what is hygiene hypothesis? Understood, everybody, what is hygiene hypothesis? अब देखो ये hygiene hypothesis का relation क्या है? What is the relation of hygiene hypothesis in asthma? In asthma, what some physicians and some scientists, what they tell is, if anybody has reduced hygiene hypothesis, or if they are not exposed to the external environmental situations in this small early age, that type of populations are having high risk of developing asthma in matured age situations. Small age में expose नहीं हुए, and in the later stages, if they are exposing to the smoke, or if they are exposing to the industrial pollution, or if they are exposing to the respiratory virus, bacteria and all, they will have more risk of developing asthma करके बोल रहे. So this is the relation with hygiene hypothesis and asthma. Understood, everybody, this relation? Understood or not? Yes, very good. अब देखो, we will proceed further with the factors. In this, see, in factors I told one is genetic factor. We will not discuss in detail about genetic factor. अगर किसी भी genetic related factor है तो then we can't do anything. And second one is environmental factor. Environmental exposure हो रहा है तो then they'll develop asthma. And we'll focus on these environmental factors. Now you see, we'll proceed further. See here, in environmental factors we have particularly allergens. In allergens we have bacteria, fungi, virus, we have pollen grains, we have grass particles, dust particles. All these things will come under allergens. Okay, if patient is exposing to all these allergens, they may develop asthma. If they are susceptible, they may develop asthma. If they are resistant, they will not develop. थोड़े patients रहते, industry में काम करते, they will be exposing to the smoke and they are always working in the dust particles, but still they are very resistant. उन लोगों को asthma नहीं आता because they are very resistant. And see, for example, myself, if I go and expose to some smoke particles or dust particles, immediately I'll get allergic reactions. Okay, so these allergens are one example of environmental factors. And next one is respiratory infections. In respiratory infections, if anybody develops frequent respiratory infections, upper respiratory tract bacterial infection, lower respiratory tract viral or bacterial infections, we have viral, bacterial, upper and lower respiratory tract infections. अगर respiratory infections frequency ज़्यादा हो गई, twice thrice, अगर if patient is developing respiratory infections, they are having risk of producing asthma. याद रख लो. Okay, respiratory infection may cause asthma. And smoking and pollution and exposing to some traffic pollution, that also may cause asthma. And weather climate condition is also important. Cold climate conditions, hot climate conditions also can aggravate asthma. And we have psychological factor also. Nowadays, actually when the patient is normal, patient is not having any asthma symptoms, immediately patient started crying due to some psychological or emotional situations. तो क्या हुआ? immediately eyes पूरे रेड हो जाते, cheek पूरे रेड हो जाते, and they'll have phrenitis and they'll start developing cough and they'll also aggravate asthma. Okay, shortness of breath आ जाता, खांसना शुरू हो जाते, all the symptoms will start. So this is psychological factor. Okay, this psychological factor में क्या होगा, all the inflammatory mediators are increased. So even psychological factor is also important. If anybody is already suffering with asthma, we should not make them cry, we should not make them emotional. Okay, so that also may aggravate asthma. And sometimes exercise also, rapid exercises, more exercises also can cause shortness of breath. And some comorbid conditions we have, some gastrointestinal disorders, some pneumonia, TB, and some respiratory disorders, respiratory infections. So that these all conditions also can cause asthma. Okay, so these environmental factors are very important. इसमें और list बहुत बड़ा है, but that all in textbooks while revising you'll understand. Okay, see, now I'll try to give you more clarity in the causes. Allergens we have already seen, pollens, molds. Molds means fungal molds, fungal growth, and house dust particles, घर में mosquitoes, mites, and excreta, all. And animals, if patient is having some pet animals in their houses, dogs, cats, and the fur of the animal के जो hair particles रहते हैं ना, if patient inhales those hair particles, or if they smell the saliva or their excreta, patient will develop symptoms. They are all allergens. And industrial chemicals we have some oils, paints, we have smoke. Okay, सब ये इसमें सब आएगा, aluminum containing dust particles. Okay, sometimes penicillins and drugs also. And here the drugs are very very important, everybody should concentrate here. सुनो, सब लोग सुनो. Whenever cell membrane is ruptured, cell membranes will produce arachidonic acid, right? This arachidonic acid will be converting into prostaglandins. These all points we already know. When cell membrane is ruptured, it will produce arachidonic acid through phospholipase A2 enzyme. This arachidonic acid is converted into prostaglandins by cyclooxygenase. We have lipooxygenase enzyme and cyclooxygenase enzyme. When cyclooxygenase enzyme activates, it will produce prostaglandins, and when lipooxygenase enzyme activates, it will produce leukotrienes, right? This physiology we already know. If we take aspirin, ibuprofen, or some NSAIDs, what NSAIDs does? NSAIDs will inhibit this enzyme. And through that they'll decrease prostaglandins. Okay, they are decreasing prostaglandins, but the aspirin, ibuprofen, and some NSAIDs, what they do, they will increase the activity of lipooxygenase enzyme, and through that more leukotrienes will be released, and it will aggravate asthma. NSAIDs खाए तो asthma आ सकता है. Do you know this point? Aspirin will cause asthma, ibuprofen will cause asthma. Why? Because they are inhibiting this enzyme and they are increasing the activity of lipooxygenase, and through that lipooxygenase will produce leukotrienes, and leukotrienes will cause bronchoconstriction. Clear? So NSAIDs is one example of drugs. And we have beta blockers. This is very very important. What directly we have beta 2 receptors on the bronchioles. When beta blockers are blocked, acts on the beta receptors, when beta receptors are blocked, they will cause bronchoconstriction. Very very easy, very very important point. That's why if anybody is having asthma, कोई patient को asthma है and hypertension है, तो do you suggest beta blockers? These are beta blockers. No, we should not give beta blockers. Already we have seen this point, especially non-selective beta blockers. Okay, and there are some food items which will cause asthma. In this we have some people are allergic to fish, seafoods, dairy items. दूध पिए तो भी थोड़े पेशेंट्स में अस्थमा आ जाता, अंडे खाए तो थोड़े पेशेंट्स में अस्थमा आ जाता. Okay, and some patients are having allergic reactions to benzoic acid. Some of them will be allergic to sodium metabisulfate. There are some drugs. Okay, even drugs and foods may cause, and some preservatives. Very 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 important point. I'm sorry. See, we have some pickles, right? Pickles के अंदर pickles are containing more preservatives, and we have canned items, packed items. बहुत सारे packed items खाते रहते हैं अपन. These packed items, canned, and all these substances will have preservatives. Some preservatives also shows allergic activity, and through that patient will develop asthma. ये चीज़ याद रख लो. Asthma patients को कभी भी canned items, packed items नहीं खिलाना. Okay. And the next one is environmental pollutants. Just now we have seen traffic fumes, traffic smoke, cigarette smoke, sulfur dioxide smoke. Okay, factories के अंदर से पूरा ये gases निकलते, carbon monoxide sometimes. All these environmental pollutants will cause asthma. and some another industrial triggers. Sometimes wood particles also. थोड़े देखो wood industries रहते हैं, wood industries, furnitures manufacture करते रहते हैं. In that more dust particles will be producing in the wood industries. That wood dust and grain dust, that also will go and accumulate in the bronchioles, and it will cause hyperactivity. Even that also causes very dangerous asthma. And some miscellaneous items we have: cold air, exercise, hyperventilation, okay, viral respiratory tract infections, emotion. चलो, so these are the different examples of asthma triggers. Okay, ये सब चीज़ें समझ गए अपन. Clear? Now next what we will see, idiopathogenesis also I think we have understood. Clear? We started from Th2 cells and how it causes activity in the tubules that we have seen. Okay, bronchioles. Now you see, we will go with the signs and symptoms. This is very important and it is little bit interesting here. I would like to add more basic points. आप लोग कहीं भी नहीं सुने होंगे, देखे होंगे. See, in signs and symptoms, what common signs and symptoms are seen in asthma? Number one, patient will have shortness of breath, right? Patient will have shortness of breath, patient will have dyspnea, patient will have chest tightness, and patient will have cough. Very very important, patient will have cough, right? इसके साथ और क्या रहता है अस्थमा में, और क्या रहता बोलो? What other symptoms you will find? Patient will have formation of sputum. Okay, sputum भी दिखता है एक बार. And what is the main symptom? Anybody from the class? सबसे very very important symptom what we can see is patient will have wheezing. How many of you know about wheezing? How many of you know about wheezing? Yes, see, when we auscultate the patient, when we find the heart sounds and pulmonary sounds and body sounds in the body, with the stethoscope, what we can find is whenever patient tries to inhale the air or exhale the air, what we can find is patient will be having wheezing sounds during inhalation and exhalation. Okay, it is like whistling sound आते रहता, और Krebs sound आते रहता. That practically when we see the asthma patients, it will be useful. Whenever we go to hospital, अगर किसी भी I mean from the 1st of September, you people will be coming to hospital, right? Second, 4th year वाले. So we will try to auscultate, and different types of auscultations, different types of sounds कैसा देखते we will try to find. Okay, so wheezing is very very commonly seen signs and symptoms in the patient. अब देखो इसके साथ just now we have seen patient will have wheezing, patient will have cough, patient will have shortness of breath, patient will have tachycardia, sometimes heart rate भी बढ़ जाता because अब oxygen supplement to the tissues is decreased, and through that what happens, to compensate the oxygen supply due to the increased demand, heart rate will be increased. Okay, and difficulty in breathing difficulty होगी, and pale and wet skin. Why pale and wet skin? Because यहाँ पे क्या होगा, oxygen supplement to the tissues is not sufficient through that. And again, dyspnea patient will have, chest tightness patient will have. Okay, all these are simple symptoms. उसके साथ देखो, there is very very important clinical presentation we can see, especially in this sputum. In this sputum, if we examine in the microscope, we can find Kurtzman's spirals. There is one. See this. Can you see the image, everybody? This type of specialized description is seen in the sputum. This type of spiral or fibers are seen in the sputum. This is called Kurtzman's spirals. Okay, Kurtzman's spirals are very very important. See, यहाँ पे आप देख सकते हैं. In this you can see, when you cough, or when a asthma patient coughs with the sputum, if we collect the sputum, and in the sputum if we find all these fiber type spirals दिखते, these are called Kurtzman's spirals. And sometimes sometimes in the same sputum and through the nasal cavity, patient will develop some crystals. These shiny yellowish crystals can be seen. These crystals are actually, these crystals are produced from the eosinophils. The eosinophils, more number of eosinophils are seen in the asthma, right? Asthma में क्या होगा? Just now I told, interleukin 5 क्या करेगा? Interleukin 5 will try to produce more eosinophils. When eosinophil concentration increases, eosinophil destruction can be seen, and eosinophil will try to produce some crystals. Okay, crystals means it is a type of crystal type of agent which is called charcoal laden crystals. याद रख लो, charcoal laden crystals. In the sputum of the asthma patient, we can find two clinical presentations. दो चीजें देख सकते हैं. Number one, Kurtzman's spiral, and number 2 Charcot Leyden crystals. Clear everybody? Clear everybody? This is the main laboratory parameter we can see in the asthma patient, and this can be used as diagnostic criteria also, along with the signs and symptoms. If patient is having shortness of breath, or if patient is having all these clinical presentations, we can diagnose that patient is having asthma. Now you see, we have some other laboratory tests. In that, spirometry is very important. I'll try to explain some brief concepts about spirometry. सब लोग ध्यान से सुनो. Are you all following me? Everybody, are you there?
Yes, sir.
सब लोग ध्यान से सुनो. अब तक जो भी अपन देखे थे वो सब all are basic things. This is clinical concept. Okay. See, spirometry is it is a technique, or it is a machine which will show some graphs. Which will show some graphs. Based on the graph reading, we can say that patient is having asthma or not. And to understand this graph, we need to know some basic things. The study of these graphs through the inhalation and exhalation is called spirometry. Simple. Spirometry is it is a machine which shows some graph which explains the क्या बोल सकते हैं. It is simple a pulmonary function test. It is a pulmonary function test. चलो देखो. अब देखो, in normal patients, this is one general graph. See, this in the y-axis we have volume of what? Volume of oxygen or volume of gas, or simply we can say volume of pulmonary tissue, volume per ml per kg. Okay, so it starts from 0, 15, 30, 37 and 80. देखो, till 15 the volume of our lung is always filled with fluid, always filled with gas. It is always filled with gas. 0 to 15 जो level है, that is always filled with gas. That is called residual volume. अपने lungs के अंदर, when you exhale, you try to exhale all your gas from the lungs. पूरा gas lung से बाहर निकालने की कोशिश करो. Everybody try to remove the gas from the lungs. If you exhale all the gas from the lungs, some amount of gas is already present in the lungs. That amount of gas is called residual volume. Clear everybody? अब देखो, this 15 mg per kg is already present in the lungs, and from this 15 to 30, sometimes it will be filled if patient is exhaling, or if patient, this amount is nothing but when you exhale rapidly from the lungs, that is called expiratory reserve volume. Actually देखो, 30 तक, till 30 our lungs is filled. Till 30 ml per kg our lung is filled with air. If you exhale forcefully from 30, you can exhale 15 ml per kg. Till here you can exhale. एक पर्टिकुलर पॉइंट से अगर एक्सेल करें तो यहाँ तक एक्सेल कर सकते हैं, एंड रिमेनिंग 15 you can't exhale because it is residual. It is already present in lungs. Okay, these two are, one is residual volume and one is expiratory reserve volume. These 2 points you understood. And see, from 30 to 37, in the normal patients, we will inhale, we will exhale, inhale, exhale. अपन कभी भी देखो, normal patients में 30 to 37 only, we will inhale some amount of air and again we will exhale, we will inhale and we will exhale. Our respiratory rate will be between 30 to 37 only, not rate, the respiratory volume. Our respiratory volume will be between 30 to 37. Suddenly, if you exhale more amount of air, normal respiration ले रहे थे, suddenly क्या करें, बड़ी सांस ले लिए तो क्या होगा, from 37 to it will reach up to 80. Try to take the long inspiration everybody. बड़ी सांस लेने की कोशिश करो तो क्या होगा, immediately it will enter till 80, and from there again what you will do, you will exhale, try to exhale all the air. Normally you will exhale till 30 से फिर दबा के exhale करें तो क्या होगा, you will go up to 15 till here, and again inspiration will go, and again your normal inspiration will be continued. So the inspiration and expiration from 30 to 37 is called tidal volume. अब देखो, I'm explaining, right? My inspiration and expiration is between 30 and 37. So that is called tidal volume. If I inhale suddenly, and in that case what happens, some extra amount of gas will be inhaled in my lungs. That is called inspiratory reserve volume. Okay, that inspiratory reserve, that excess amount of volume that I am inhaling, that is called inspiratory reserve volume. And this inspiratory reserve volume अगर यहाँ तक till 30 if I exhale, it will be between tidal volume only. अगर tidal volume से नीचे ज़्यादा गैस छोड़ दिया तो उसको क्या बोलते हैं, that is called expiratory reserve volume. I think you all are following this point. Just इसमें difficulty कुछ भी नहीं है. Just try to understand what is tidal volume, what is expiratory reserve volume, and what is inspiratory volume. Now you see what is vital capacity. This is very important. What is vital capacity, which is called VC, or which is also called total vital capacity. Vital capacity क्या है? From 80 to 15. From 80 to 15. अब देखो what I did, I exhaled the air. दबा के हवा पूरा बाहर निकाल दिए. I exhaled the air. So my lungs is having 15, right? My lungs is having 15 ml per kg. And suddenly what I did, from here, I try to inhale the air and it will go up to 80. And from 80 again I'll exhale total air. I'll exhale till 15. The area from 15 to 80 and from 18 to 15, this total inspiration and total expiration, that is called vital capacity. How many of you understood what is vital capacity? Vital capacity क्या है? समझ गए सब लोग? Very good. Vital capacity is nothing but if you exclude residual volume, the remaining volume जो भी है, that is called vital capacity. Clear everybody? अब see, now you'll get more clarity. Everybody should concentrate here. See, the y-axis is explaining the volume and the x-axis is explaining time. Okay? X-axis में time है. We will take 4 seconds. And in the volume, see, approximately our lung volume is 5 liters. Do you know this point? Our lung volume is 5 liters. And in this 5 liters already यहाँ पे 5 liters में मान लो 1 liter already we have. अब 1 liter already we have. 1 liter or half liter will take. Half liter is already, half liter क्या है? Half liter is residual volume, right? So approximately up to 1 liter it is already present in the lungs. Now what you will do? You have inhaled total volume in the lungs. When you inhale total volume in the lungs, when you take deep breath, or when you inhale deep breath, so how much volume your lung will have? When you take deep breath, how much volume your lung will have? What is the volume of your lung when you take deep breath? Not 80. See, that is ml per kg. That is ml per kg. ये छोड़ दो. See, our lung capacity is 5 liters, right? Our lung capacity is 5 liters, and in that 1 liter is already present. Residual volume 1 liter मान लो. Just imagine 1 liter is already present in the lung. And remaining 4 liters, what you did? You have inhaled. Deep breath ले लिए तो अब lungs के अंदर कितना वॉल्यूम है बोलो? 5 liter. So when you have taken deep breath, your lung is having 5 liters of air. बराबर? This 5 liters of air, what you will do? You will try to exhale out now. These 5 liters of air, you will try to exhale out. बड़ी सांस लेके बाहर छोड़ो. बड़ी सांस ले लिए और यहां से क्या कर रहे हैं? We are leaving out. बड़ी सांस ले लिए and we are leaving out. बड़ी सांस ले लिए and we are leaving out. When you take long breath, okay, and see, when you start exhaling out, maximum 4 seconds you will exhale. How many minutes you will exhale? You will try to exhale for 4 seconds. See, the amount of fluid which is exhaled for first second is called forced excitatory volume 1, which is also called FEV1. Now what you are doing? You have inhaled the forcefully inhaled air and you are exhaling that air forcefully. So on the first second, यहाँ से देखो, यहाँ से you are exhaling the air. In the first second, you are exhaling 4 liters, and in second second you will exhale 4.5, and slowly on the 4th second total amount of air जो भी अपन 5 liters लिए थे, that will be exhaled out. Am I clear? जो 5 liter अपन लिए थे, you have exhaled, you have inhaled the 5 liters of air and you are forcefully exhaling the air out. Actually, one thing here, actually 5 liters is not the total capacity. Total capacity may be 8 liters. 8 liters रहता, मान लो. Okay. Approximately it is 7 to 8 liters. Okay, 7 to 8 liters. And now what we are doing? We are inhaling 5 liters of air. 5 liters of air ले लिए and we are exhaling that 5 liters of air. तो यहाँ पे simple point what I want to tell you is, when you forcefully exhale the air, On the first second you will exhale 4 liters. On the second you will exhale remaining जो भी है वो निकलेगा. And up to 4 seconds you will exhale total amount of air, right? In 4 seconds you will exhale total amount of air. This is the normal exhalation patient. In the normal exhalation patient, normal patients में exhalation ऐसा रहेगा. अब देखो यहाँ पे देखो, सब लोग ध्यान से सुनो यहाँ पे. This blue color line is normal, right? And this black color line is asthma patient. What asthma patient did? Asthma patient inhaled and asthma patient is trying to exhale out. Asthma patient is trying to exhale out. तो यहाँ पे देखो, on the first second, how much fluid, how much air he is exhaling out on the first second? How much air he is exhaling on the first second? He is exhaling 2 liters. And on the second, he is exhaling 3. And see, actually, he is exhaling total amount of air in 5 seconds. I mean, जो 4-5 seconds जो भी है, he is taking lot of time to exhale out. Whereas in normal patient, एक ही सेकंड में 80% जो भी है पूरा बाहर निकल जाएगा. In normal patients, the FEV1, अब देखो सब लोग ध्यान से सुनो यहाँ पे, we have to find out the ratio between FEV1 by FVC, total volume जो भी है, total volume. FEV1 by total volume. अब FEV1 कितना है in normal patient? What is FEV1 in normal patient? It is 4. FEV1 is 4 and the total volume is 5. In normal patient, FEV1 is 4 and FEVC is 5. See, FEV1 is first second, FEV2 is second, and FEVC is at the end of the 5 seconds or 4 seconds, whatever. That is FEVC. FEVC कितना होगा? 5 होगा. FEV1 क्या है? 4. If we divide 4 by 5, it will come roughly around 0.8. And if we multiply this with 100, it will become 80%. 80%. तो इसका मीनिंग क्या है? In normal patient, the ratio of FEV1 and FEV should be 80%. And now you see, in asthma patient you try to calculate the ratio. In normal patient you try to calculate the ratio. अब यहाँ पे देखो, calculate करके बोलो. What is FEV1 in asthma patient? What is FEV1? It is 2. And what is total volume? It is 5. So 2 by 5, how much it is? 2 by 5 कितना आ रहा बोलो? 0.4 into 100, it is 40%. So देखो, the ratio of FEV1 and FEV should be 80, no? It should be 80. If anybody gets less than 80%, the ratio of FEV1 and FEV, if anybody gets less than 80%, that indicates that patient is having obstruction. समझ गए सब लोग? What is obstruction? If anybody is unable to exhale the air properly, in first second person should exhale 80%. The value should be 80%. But if anybody is having obstruction, 80% नहीं निकलेगा, 40% ही निकलेगा, 40, 50, 60 जो भी है, depends on the intensity of obstruction. So this type of graphs, which will explain the ratio between FEV1 and FEV, this type of graph is called spirometry. See, now here you try to actually see, in normal patients, actual graph ऐसा आएगा अपने को. In hospitals we'll get a graph like this. When patient inhales, immediately the patient will exhale. Inhalation जितना भी ले रहे, exhalation should be like this. In obstructed patient, you see, in obstructed patient, when they are inhaling, exhalation is not immediately, the air is not coming out. Slowly the air is coming out. The graph कैसा दिख रहा देखो. The graph length is increasing, right? Parabola type of graph आ रहा है यहाँ पे. I mean the length of this graph is increasing. This explains us that patient is having obstruction. And there is another concept called restrictive condition or restriction. यहाँ पे inhalation कम हो रहा है and exhalation also decreasing. Inhalation is decreasing and exhalation is also decreasing. That means patient is having restriction. Obstruction and restriction are two concepts which are mainly associated with pulmonary diseases. Normal patient में ऐसा रहना actually. In obstructive patient, the graph will be like this. Now you see, I'll try to show you the exact. In hospitals, we will find like this. What is asthma patient? How to find out asthma? By seeing this graph, you see, the dotted line is normal. The dotted line is normal. But see, the patients, due to the obstruction, the inhalation and exhalation is totally decreased, no? If the patient's graph is same like dotted line, that means patient's pulmonary tissue is normal. If it is less than the normal, that is called patient is having pulmonary disease. So depend on this pulmonary function test, the pulmonologist will decide whether patient is having asthma, patient is having chronic obstructive pulmonary disease, or patient is having restrictive disease, or patient is having any TB or any emphysema or any other conditions. Okay, by seeing this, इसमें ये ग्राफ में कुछ डिफिकल्टी है. In hospitals, by seeing this graph, you should understand the dotted line is normal, and the other one is the implicated value or the actual value what patient developed. By seeing this graph, we can easily understand that patient is having abnormality in pulmonary function test. Clear everybody this one? Clear or not? सुन रहे कि नहीं सुन रहे? सो गए होंगे सब. In that pulmonary function test, it is very easy. उसमें और थोड़े concepts है. I'll try to explain in the next classes. Uh, I'll stop the class here. In next class, I'll start with all other concepts associated with asthma. We'll start with pharmacology. Pharmacology detail में पढ़ेंगे all the drugs, and then I'll explain you the strategies, treatment strategies, including all guidelines, how to treat asthma. And in asthma, we have some classification also. We have intermittent asthma, we have acute asthma, we have mild persistent asthma, we have moderate persistent asthma, we have severe asthma, and there is a condition called what we say continuously asthma आते रहता patient को. Okay, in that condition also how to treat, all that treatment strategies, classification, pharmacology, and treatment strategies we'll see in the next class. Okay.